Hi everyone, my name is Dr. Uri Burstyn. This is little Claudia, and Mr. Pirate will be joining us later on in the video. And yesterday, I got punched in the eye by a cat. Sad but true. Oh, hello, Mr. Pirate. There he is. Come back here, little man. Now, like most injuries that happen when humans get bitten or scratched by an animal, it was entirely my own fault. I was examining a cat that was known to be aggressive, and of course I got right in his face, and I had to look at facial symmetry, which is an important part of any physical examination. But I'll admit, I do get a little bit closer than strictly speaking necessary to most of my feline patients. That often happens. And I thought I was far enough away, but clearly I wasn't, because the cat reached out and whacked me right in the eye. So as you can see, I got this little laceration right on my eyebrow and right on my lower eyelid. So I got a flash of blood, couldn't really see out of my right eye. Those of you who watch boxing know how much an eyebrow cut bleeds. Walked over to the bathroom, wiped it all off, sealed it up with a little bit of Vaseline, made sure that my vision wasn't affected, and boy was I lucky, because the cats got me right in the eyebrow, right in the eyelid, just below the eyelid margin, but luckily my cornea wasn't scratched, so I could see fine, so I went back, finished the exam. But I really dodged a bullet here, and this could easily have blinded me or at least seriously affected my vision for quite a few months. I don't know if any of you have had a corneal scratch, but it hurts like bloody hell and can definitely affect your vision. So I was very, very lucky yesterday that all I got was a flesh wound. And sure, now I can play The Witcher on TV without any makeup, but I don't think Henry Cavill's going to lose his job anytime soon. And one of my staff members did mention that I might end up with a cool anime scar vertically across my eye, which is something to look forward to. I'm not entirely against that, but it definitely made me reflect on what a dangerous job it is to be a vet. And a lot of people maybe don't realize this because, they think that vets just, play with cute, fluffy animals all day long, but being a vet, relatively speaking, is a very, very dangerous profession. There's a lot of injuries in our line of work. Sure, it may not be as dangerous as being an uninvited tourist from Russia and Ukraine at the moment. However, most veterinarians and vet techs and nurses that I know their arms and hands are covered by scars, and I've always been quite proud that I have really fast hands, so relatively few scars from animal encounters, but now I got a really good one, I missed 100 small ones, and I got one really, really, really good one. But before we proceed, Claudia actually has a special announcement to make. Claudia, where are you? Come over here. What's that? Oh, you want me to talk? Okay, I'll talk. You just supervise. All right, guys, I'm very excited to announce an online course that I'll be offering later this spring about how to start your cat off right. It's going to be aimed at both the people who are bringing a new kitten or a new adult cat into their life, as well as experienced cat owners who just really want to fine-tune their feline management. This course is going to help you go from being a well-meaning cat mom or dad to being a cat care pro. And to help me develop this course, I'm going to be doing a series of live seminars at the end of this month, in which I'm going to present the course material in a live and interactive fashion. I'm going to present the course, and I'm going to take live questions and have discussions with the course participants. Now, if you want to be a part of these live seminars, please follow the link in the description below and sign up now. I also haven't completely decided on the title for this course, so if you have any suggestions on what I should title the course, please leave them in the comments below. I'd love to hear what you have to say. I'm really excited about these courses because I think they will help a lot of people out there to have a better and closer and healthier relationship with their cat, and of course, help the cats. Was that good, Claudia? All right, Claudia approves. Now back to the video. So I wanted to make this video just to share with you some of my stories about how dangerous being a vet can be, so you guys can appreciate how we, and by that I mean veterinarians as well as our teams, from technicians to tech assistants, vet nurses, we all put our welfare, health, and bodies on the line to help animals, because of course, often our patients don't realize that we're here to help them. And I always say that one of the most satisfying things about treating cats is the chance to help an animal that wants to kill you. And I mean, it is very satisfying, but also a little bit dangerous. I mean, the very first time I got injured working as a vet was literally my first week out of vet school. I was working in an emergency clinic straight after graduation, which is not something I'd recommend to every veterinarian, but I worked as a tech all through vet school. I worked as a tech in an emergency center. So I really grew to love emergency medicine, and luckily I was able to learn a lot in that job. So I was very cocky, and I went into emergency gigs straight out of school. Again, not recommended. And I had a pug who was acting funny. Turned out he had neck pain. Now, at that point, I knew how to do a neurologic examination, which already put me ahead of like most of my colleagues with 10 years experience. However, I knew this in theory. I haven't actually done very many, and unfortunately, I haven't done any under the mentorship of an experienced doctor, which is unfortunately the case for most vets. Most of our training is deeply lacking, and this is something I could make a whole series of videos on how poorly veterinary training equips us to do the job that society expects of us. So a part of a neurologic examination is checking for neck pain, which requires manipulation of the neck, and you see if there's any resistance or what we call guarding from the patient. Of course, this pug had slipped a disc in its neck, so it's super painful. And I reefed on its neck, and first thing it did was turn around and just bite me as hard as it could on its. Luckily, this was a pug, so it couldn't bite me very hard. Bit me right in the thumb, gave me a good bruise. Luckily, didn't break the skin. And I learned to be very, very careful with neck manipulations from there on out. But yeah, first week out of vet school was my very first dog bite. And I would say that it is very rare. It's rare for a year to go by without somebody going to the hospital because of an animal bite on the average veterinary team. Often it happens more than once a year. I don't know exactly what the rate of injury among veterinarians is or veterinary workers, but anybody who works in a vet hospital has been scratched or bitten at some point, and these can range anything from just a light scratch to nearly losing vision in one eye like I did yesterday. Probably the worst thing that happens to the average veterinarian or the average vet technician is getting bitten by a cat. Now, the reason for that can be seen if I just turn Mr. Pyatt around. Notice fangs. Fangs on a cat. Big, sharp, pointy teeth. Now, Pirate has a very nice, healthy mouth because I clean his teeth regularly. But cats have a lot of bacteria in their mouth, and particularly cats who don't get regular dental care. So when they bite you, their teeth do a deep puncture into tissues. But if you notice, those fangs are nice and narrow. They're like little needles. So they puncture a tissue, and then they pull out, and the tissue closes up. So what you end up is having a closed wound that's very deep. And that tooth has just inoculated the wound with bacteria, who are often what we call anaerobic bacteria. So these are bacteria who thrive in the absence of oxygen. And of course, because the wound is closed, there's no oxygen. So cat bites often produce really nasty deep tissue infections and are always sort of in a medical emergency. And unfortunately, they also often happen around the hands and fingers, which is of course because we're handling the cats. And it's even worse when that tooth goes into a joint, because then it inoculates the joint with bacteria, the wound seals up, and you have an anaerobic infection in a joint. Really bad news. Could potentially cause very severe arthritis and long-term damage. So let's just say whenever there's a cat bite, you always end up going to the emergency room and getting antibiotics. So you end up on antibiotics pretty routinely if you get bitten by a cat. And these can be quite nasty. Most of the time, it's just like a week or two of ampicillin or amoxicillin, and you're fine. But occasionally, you do get pretty disastrous outcomes. I've certainly heard of people who fail to go to the emergency room right away, ending up like with septic shock because having gangrene in their arms. So these can be surprisingly nasty. Scratches usually aren't, again, unless you get them on your cornea. So cat bites are pretty common. Dog bites are a lot less common, but can also be a lot more devastating, because you can imagine having a pug bite your thumb is not the end of the world. Having a cattle dog or a Rottweiler bite your face, a lot worse. And here's the trick. Cattle dogs, so like Australian Shepherds, Border Collies, awesome dogs, very intelligent, but they do this thing. They do this thing that is awful for vets. Some cattle dogs, particularly ones who are fear biters, who get anxious and attack you, they wag their tail when they're anxious. This is a really dangerous thing that, again, one isn't really taught in school. You got to learn this by experience. And I have this one patient, when I see a dog, I'm like, hey, sweetheart, come here. I want to give you a hug, right? And I have this one patient who's a border collie, of course, who just looks straight in my eyes, wags their tail, and then lunges at your face trying to snap you. So, yes, Pirate, I know it's very scary, but don't be worried. I'm okay. I'm too fast for that silly cattle dog. So yeah, cattle dogs do that, and it's super dangerous for vets. I have definitely heard of people who've been caught out by that, and they end up going to the hospital with a pretty nasty bite either on their face or their forearm as they bring it up to guard themselves. Yes, bloody cattle dogs. Most dogs give you warning signs before they're ready to bite you, and if you read their body language well, which you do if you work with them enough, you can kind of tell when one's about to become dangerous. But the other thing, there are some dogs who fear bite without warning. Again, if that dog's a Shih Tzu, yeah, it sucks, but it's probably not super dangerous. If that dog's Doberman, it can get pretty ugly. Again, luckily this doesn't happen very often, but there's one there's one warning sign that every veterinarian learns very early, that a dog is dangerous, and that is the owner going in the room with you and saying, "Oh, he's a good boy. Yeah, no, he's never bitten anyone." 100% guarantee you that dog has tried to bite a veterinary worker in the past, and the owner knows this. So if you're the owner of a dog who's aggressive, a fear biter, or has bitten somebody, don't go into a veterinary room and say, "Oh, no, he's never bitten anyone." I guarantee you 100% of the time, if an owner says that to me, my ears perk up and the muzzle goes on, because that is a dog that has bitten someone. Just without fail. The responsible owners will be like, "Oh, please be careful. My dog has been known to snap at vet workers or veterinarians." Most people are pretty cool about that, but something about that, I guarantee you, if anybody tells you your dog's never bitten anyone, that dog has bitten a vet. So being a veterinarian definitely carries its risks, and I haven't heard of many small animal veterinarians who've had like career-ending injuries, but you know what? I do worry about it, because probably 80% of my income comes from doing surgeries, and also 90% of my work is waving my hand around the mouth of animals I've barely met. And I've scrubbed before with like bandages on my hands, scrubbing and gloving, and then trying to do surgery when you have a hand injury really sucks. I often stop and pause to think like, what a silly profession I'm in, because literally, like, surgeons are usually very protective of their hands. I have absolutely no option to do that. I must work with my hands. I must touch my patients. I have to reach my hand to the mouth of animals pretty much on a daily basis. And yeah, it's just part of being a veterinarian. So that a lot of people don't really appreciate. But small animal veterinary medicine is just one part of the profession. Don't forget, there's also large animal veterinarians. And they're the ones that have the really rough job. You haven't really lived until you've had to jump up over a fence with an angry cow chasing you. Cattle work isn't even that dangerous. But believe me, you fly pretty fast when there's like 600 kilograms of angry bovine charging towards you. And of course, cattle veterinarians are really known to get chronic injuries to their shoulders, their elbows, and their back from all the preg testing they do. I'm not going to mention what preg testing is in polite company, but if you guys want to look that up, you're more than welcome to. Let's just say it is a necessary part of our profession, very important part of the job, but it certainly lends to chronic stress and chronic injuries. But horse work, that's where it really gets crazy. Horses are basically, the way I think of a horse is a 500 kilogram 2-year-old with metal shoes who's prone to throwing tantrums. That's a horse. And you can imagine how dangerous it can be to work around one. And I have the deepest respect and compassion to people who love horses and love working with them. I understand you. I also love horses, but I hate working with them because, quite frankly, my life is worth more than that of an equid. Sorry to say, I know there's a couple $1 million horses out there. I would still rather be alive than treat them. And more importantly, I don't want to have brain damage. Because you know what? A good kick to the head, nice depressed skull fracture, that is not something anybody should experience. And yet vets risk that all the time under the most bizarre conditions. I could tell you guys stories all day, but I'm going to tell you one that I personally experienced about horse work that should illustrate just how insane you have to be a horse vet. And I say this with the greatest amount of affection for equine vets. As a vet student, I spent a lot of time learning how to work with large animals. And a part of that was, particularly in the final year, was actually spending time in large animal practices and following large animal vets around. Now, a complete waste of time, since of course 90% of veterinary graduates nowadays go into small animal medicine, but the veterinary education system is so far behind the times that they still feel the need to teach veterinarians to do everything really badly rather than teaching us to do the job most of us will do really well. So despite the fact that I think that teaching every veterinarian medicine of large animals, small animals is a complete waste of time, it was really fun. I love vet school, and certainly I had a great time working on farms and learning all these cool skills. It was a great adventure, just useless and irrelevant to professional training. But that aside, I spent some time in a place called Bomaderry, which is a kind of a hamlet or really small village, a couple hours south of Sydney. And I spent that time in a mixed animal practice, which was doing both cats and dogs and also providing some vet care to the surrounding farms. And I followed around the vets there, and it was a fantastic experience. I love those guys. If you ever see this video, that was one of my favorite prac work placements of my schooling career. So thank you very much for hosting me back in the day. It was a great experience. But one day, while I was a student following a vet around on practicum, we got called out to this farm, which was owned by an orthopedic surgeon out of Sydney, which was one of the big clues that I had in my veterinary career, that I was trained to be the wrong kind of doctor, because it was a gorgeous giant farm where his wife and his daughter basically ran it as a retirement home for old nags. They had a herd of, I think, like a dozen horses that basically just were shaggy little old things that just walked around the hills and weren't really touched or handled at all, except twice a year when they were brought down out of the hills to have their teeth floated. Now, horse teeth grow their whole life, and when horses get really old, they'll often develop spurs that can actually impede their ability to eat. They'll cut their cheeks, and they'll die from these if left untreated. So one has to float their teeth regularly. Actually, go in there with a giant file and file down physically those teeth, like rasping the teeth inside the mouth of a horse. Now, if this sounds like a completely insane thing to do, you're right. It is a completely insane thing to do, but it had to be done. And of course, these horses, they're not well-handled horses. And if you have a horse that's, like lives on a racetrack and gets handled all day, this is a pretty manageable job. They'll just stand there and let you do whatever you need to do. However, these horses are basically wild animals. And so we had to bring them down out of the hills. The farmhands did it. The wife and the daughter just stood around sort of watching us work and pretending like they're useful. And they brought these horses down from the hills. So the vet and I arrive in our truck. We have to sedate the horses. But of course, they're horses. Nothing's ever easy or sensible with them. You have to sedate them. But if you give them too much sedation, they fall over, break their leg, and they're dead. You have to put them down. So you have to give them just enough sedation that they're chill, but not so much sedation that they lose their balance, fall down, break their leg, and die. Which means, of course, you can't give them too much sedation. So we had these horses semi-sedated. And then literally, like as ridiculous as this might sound to you, the viewer who's not a veterinarian and doesn't own horses, I went over there, I had to hold this horse, and the vet stood in front of it with a giant rasp, reached into its mouth and started rasping those teeth. And these horses were like throwing their heads around, they were bucking. One of them stepped on my foot and actually broke a bone in my foot, but that's just a minor thing. I just limped for a week or two and I was fine. They were also striking forward. Horses do this thing where they lash out with their front foot. If they get you, they'll break your shin or pop your kneecap out. Like, this is a serious strike. So the vet he just kind of joked with me that he has to be pretty quick to jump out of the side. And luckily, pretty much the only thing the sedation did was it made the horses a bit slow so we could jump out of the way relatively reliably. And this guy's my hero. He is so goddamn brave. He was there, and we had to do I think at least 5 or 6 horses that afternoon. He was in there, floating their teeth, sticking this giant rasp in their mouth, and just filing down those spurs, while me, who, frankly speaking, I'm not the best, I'm okay with horse husbandry, but I'm not an expert farmhand, was doing my best to hold these crazy horses still halfway through the day with a broken foot. And it was just an absolute gong show. And at any point, that horse could have reared up and, kicked him in the face, or, he dodged all the front kicks, but at any point, he could have had his shin snapped. It was just ridiculous. At one point, a horse, he told me there's a big shed in the field where we were doing this. And he's like, well, if one starts bucking, duck behind the shed. That was his advice. Like, such a mensch. Oh, that guy. He's awesome. So, of course, at one point, a horse got away from us. And we both just duck around the corner of the shed. And then the whole shed just thundered as this horse double-barreled into the other side of it. I'm surprised the thing didn't fall down because it was made out of rotten wood. And then, once the horse calmed down and got his kicks out of the way, we walked back out. I grabbed the rope, go back to holding it, finish floating our teeth. That is an average day in this man's life. And I'm pretty sure, I think he got paid like maybe $500 for this whole show. There is no world in which this job is worth $500. We literally risked his life or like many months of disability for $500. And of course, this was done on humanitarian grounds because, what can you do? This is a part of being a vet. It's completely insane to do this kind of work, but also the horses need it. Without it, they'll suffer and die, and people want to keep them alive. But of course, the orthopedic surgeon's wife didn't want to pay higher than market rates. And so $500 it is to literally risk having your arms and legs broken or getting kicked in the head. So this is a completely normal part of a horse vet's life, which is one of the many reasons I will never be a horse vet. Oh, thanks, Claudia. You're such a little trash gremlin. So yeah, being a vet, it's kind of a dangerous job. And I don't think many people appreciate this, but now you do. So thank you very much for watching this video and listening to my stories. I do hope you found them entertaining. And of course, before we go, Slava Ukraini!